A new report out is raising concerns about the number of children that have been diagnosed with ADHD, and nearly immediately they're getting medicated.
See, the concern here is that standard recommendation suggests children should be given behavior-based therapy first before doctors turn to any medication.
I didn't even know this. I didn't even know that was the recommendation. So ABC medical correspondent Dr. Darien Sutton is here to talk more about it. So, I mean, Doc, that seems perfectly legitimate, but it also seems to me that kids are going in the office and they're coming out with a script.
It does seem that way, and the study and the numbers show that that might be the reality. So this is a large U.S. study, and it's examining the diagnosis of ADHD, attention deficit hyperactivity disorder, and how quickly medication is prescribed, specifically for young children, children between the ages of 3 and 5 years old. And what they found was that after a diagnosis of ADHD, which was found in about 10,000 preschoolers out of a total of 700,000, nearly 42% were prescribed their medication within 1 month of their diagnosis. Now, why that's concerning is because guidelines recommend that after a diagnosis, children get at least 6 months of behavioral therapy. Only about 14% of students, or excuse me, children in this study were able to get that appropriate therapy.
Wow.
I have a question. This is mostly for behavioral reasons that they're getting medicated, because I know a lot of kids who are getting medicated, who are getting diagnosed with ADHD. It's not for behavioral reasons, it's because they can't focus.
Yeah.
So is there a difference there?
There is a difference in the attention, the inattention, hyperactivity. It can present in a variety of ways. More specifically, a difference between boys and girls.
That's where I was going.
Boys more typically have extroverted symptoms, where they're disrupting class if they have a diagnosis of ADHD, or they're being more active, whereas they're finding that girls are more introspective in their diagnosis, more likely to zone out, more likely to be chronically disorganized. And so the signs and symptoms of ADHD can be very much difficult to spot, especially if you're not trained. But I just want to focus on these numbers. This is very much not a question of choice. It really reflects a gap in access. The parents feeling compelled to seek out medicinal treatment because they don't have access to therapy. I think that's the real issue here. I don't think that many parents are wanting to jump into medication, but that might be their only choice.
Well, we saw there was disparities there.
Yeah.
Can you tell us a little bit about that?
Yeah, so some of the disparities that they see in communities which have unfortunately higher rates of poverty, for example, you see higher rates of medication use. Again, that's not likely a response of parents. That is likely a response to the lack of access to appropriate treatment. And when you're in a situation like that, you can only imagine as a parent trying your best, especially if you have more than one child, to make sure that they get the education, that they get the social relationships. And again, that might be their only option. So this also should be taken into respect with the policies that we have.
So you're saying go the therapy route first. What do those therapies look like?
Yes, great question. So number one, if you're finding that your child is displaying symptoms of ADHD, whether that be the external or the internal symptoms, you want to talk to your pediatrician about getting a comprehensive examination, and then talking to your pediatrician about what else can be done. For example, might there be community programs or school-based programs? But one interesting thing that I've learned through this is there's also parental training, helping parents to understand how to structure the lifestyle around a child suffering with ADHD. Because that takes training. Many parents who talk to me, every day is your first day on the job. So sometimes you're not trained to be able to, or equipped to deal with these types of situations.
Makes sense.
Oh, man, this hits home for me. I'll just say that. But thank you.
It makes sense. Yeah, just really quickly, I just want to know too, if medication, however, if it's safe for kids to take the medication, why is it's such a problem that they're going to medication first before behavioral things?
Yeah, well, with each intervention, medicinal especially, there's always a risk. So as a physician, you want to make sure to educate families about the possible benefit, but also the possible risk. And your goal as a doctor is to maximize that benefit and minimize that risk. And so you want to make sure every decision is.
You want to watch them even if they get on the medication, just to see if there's anything that you're uncomfortable with.
Absolutely, close monitoring is very important.
Yeah, check every box first before you go there. Okay, Dr. Darien Sutton.
Of course.
Thank you. Appreciate it.